Hello and welcome to Sensei podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello, everyone, and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, Dr. Adriaan Kraaijeveld from Utrecht, Netherlands. Great CTO operator, great friend. Adriaan, thank you so much for joining us today on the podcast.
Thank you for having me, Manos. It's a great pleasure.
Adriaan, we'll start this podcast by having everyone just give us a little sense of where they started, how did they get into intervention, how they decide to go into this complex world full of stress and other issues as well.
Yeah, well, so I've been practicing as an interventional cardiologist for, I think, over 10, 11 years right now, starting with my fellowship, obviously. Back in Leiden, at Leiden University in the west of the Netherlands. I moved to Rotterdam, to the Maastad Hospital, back then with Pieter Smitsen, Martin van der End, and George Vlagoyannis. And so I did the last part of my fellowship over there, and it was quite a high volume PCI center offsite. We didn't have cardiothoracic surgery, but there was an interest in complex PCI. Obviously, the patients were there. That was like 10 years ago, and you just released your first manual of CTO interventions. We'll come to that later, I guess. And I had this interest in this complex stuff, and there was this vibe. It was all starting with the hybrid operators. That movement was gaining ground, and I was interested in that. And then I visited a workshop by James Pratt back in Utrecht. It was in 2014 or 15, I think. He really opened my eyes for CTO intervention. And I started starting to get some experience with these interventions. Also, I had to commute every day from Leiden to Rotterdam, most of the time by train and by public transportation. So it took me 1 hour back and forth, and it was a great opportunity to read your manual, actually, on all the aspects of CTO intervention. So, I started doing these things, treating my first patients, and also I started or I was proctored by Paul Knapen and Alex Knapp from Amsterdam, obviously. So I was one of the first which they proctored here back in the Netherlands, and after that they proctored many colleagues in our country, but I was one of the first. And then I moved to Utrecht, and I got an academic hospital. I got more room to build my experience. So in Utrecht we had Pier Francesco Agostoni. He left the department, so I was the replacement of Pier Francesco, who already had quite a good CTO program going. So it all went from there.
Wonderful. So a lot of familiar names and a lot of coincidences, I guess, training and then meeting other people and moving on. But still, doing the CTO procedures, it is a fairly painful part, right? It can be long cases, and you could have a much easier life. So what made you want to get into this area?
Yeah, well, that's a good question. So I never back down from any challenge. That's my problem. So when I see a challenge, or when I see a clinical question asked, and we have these opportunities, I have the tendency to go for it and just see if I can help the patient, but also gain and improve my own skills to see if we can tackle the problem. And I take some pride, or I like to go one step beyond where most of our colleagues don't want to go for whatever reasons, or don't have the time to do it, or whatever. And unfortunately, I'm in currently in an environment which supports those decisions, and where you can do some complex work, and there's room and time and funding and personnel and all that to do more innovative things, not just CTO PCI, but also other structural heart things, etc. It's a challenge, and don't give up, and try to achieve to the best of your skills, your best of your abilities.
And were you always like this, that you always wanted to push the envelope
Yeah,
and
I think so. If
go
you
for
would
the
ask
extra?
the people in my environment, they wouldn't be surprised if you ask them the same question. Yeah, so um, I've always been a hard worker. Not just for CTO or cardiology in particular, but I had to work hard at school as well. So medical school, but also high school. I really needed to study, because otherwise I wouldn't pass. I'm not Albert Einstein, so I really had to work hard for it. So already a long history of just work hard, and then you will get there.
Wonderful. And then, as you said, the environment is also critical. You were in a friendly environment, and I'm sure Pier Francesco also has been doing some nice work there before. How supportive were they, and how important was that for you building up the program and getting it to the next level?
Yeah, very important, because you see other role models teaching you and telling you how to do things, also how not to do things. Or when you see them do things, you think to yourself, well, maybe I should do it in a slightly different way. But supportive peers are really, really important. So also back in Leiden, when I started doing my first angioplasties, etc., my trainer, as we would call it, opleider in Dutch, he was really was a very strict man, but he was also a great guy. And but he gave me the opportunity to also just perform my first angioplasties and STEMIs, and just do it. And then all of a sudden he pulled out, I don't know where he gathered them, but 3 anterior wall infarctions within 2 hours time. And just do it. And yeah, it builds you confidence. And at that time, it was the most scariest thing I ever did. But together with my colleagues, we did it. And looking back, then you realize how important that moment was. And so for angioplasty per se, so having to deal with a very sick patient who, I don't know what, not in shock, but still an anterior wall infarction. And so you get a little bit of sense of urgency, and so it helps building up this experience. And once again, like I said, also in Rotterdam, which was a high volume center, they still were patient with me, and just to try to do the first steps in CTO, not directly retrograde, because you need more time, you need more patience, also not with yourself, but also with the team, obviously. And have good support. I think it's really important to have good proctors, because otherwise, you don't learn it like the way you should. And I was very fortunate to be proctored by Paul Knapen and Alex Knapp. And I also visited their lab back in Amsterdam and the VU a couple of times, obviously, and got the opportunity to participate and see. So, yeah.
Wonderful. Yeah, the long line, as you say, long heritage, great operators, great teachers, which helps a lot. Now, how about the stress? When you do those cases, sometimes things go well, sometimes they don't. How do you deal with that part?
Yeah, Manos. Well, as you gain more experience, you've dealt with those complications a number of times, obviously. But in the beginning, it could be very stressful. And what I tend to do is just stay calm as possible. Always try to gain help from coworkers who are in the lab, also other interventional cardiologists, just to help you out in a difficult situation. So, but yeah, sometimes you have to make split decisions or very quick decisions in split seconds, like today. when you mentioned it, we had a perforation of the LED, and it was a big perforation,
shit.
tamponade, etc. And we dealt with it, and it was a team-like effort. So, yeah, how to deal with the stress? It's always there as an interventional cardiologist, and you have to be comfortable with it, and you have to embrace it in a certain way, because otherwise, life gets hard. But still, it's a demanding job. So yeah, try to unstress after work. That's really important. And also a learning environment helps. An environment with your co-workers together with the nursing staff. Try to discuss it and in a professional way.
Wonderful. Now, in terms of the preparation, are there any specific rituals or ways that you handle things? Or just look at the films. Is there anything that you do special that you evolve over time? How do you prepare for those cases?
Well, so we always try to review the cases when we start the day with the whole team. So there could be one or two operators. My colleague Tim van der Hoef and I do the complex CTO stuff and the chip cases, and we try to review every case up front with our nursing staff. And I even just recently also started with my CTO team just to let the nursing staff tell me what to do. That's an indirect way of for them to learn as well, and that it helps them or be engaged in the whole situation, obviously. But that's what we tend to do, and then we just prepare the patient, take care that we're aware of all the lab results, all the medication, etc., and just have a good review of the angiogram and come up with a good plan. So it's not.
Wonderful.
We're not doing things ad hoc. That's not how we operate here in Utrecht. We try to plan everything as well as possible, and yeah, that's the way we do it. Always a hard team discussion, etc. Yeah.
Perfect. And that's the best way to go. And the beauty, at least for the CTOs, is that these are elective cases for the most part. So you do have the luxury of time, and you can do the planning, which, as you said, can help you a lot down the line. In terms of learning, what did you find the most difficult thing? What was the thing that gave you the hardest time to learn?
Well, I think it's just what the Germans call the Fingerspitzengefühl. You really have to feel the plaque. You have to be get this feeling of the different equipment, microcatheters, wires, etc., in relation with the patient or in relation with the plaque you're dealing with, and it takes time. It's for me, it took some time, obviously, and now you just know, okay, based on this and that, I can choose that wire because I know it will behave like this or that. And it's great that we still have this improvement in wire technology, and that's amazing. I think the Neo Gladius EX is unbelievable, but still, yeah, it's you can't say I'm a CTO operator after 25 cases, for instance. You need this to go through this pyramid and this incline of learning, and for me it was I think especially when we're talking about a specific technique, I think it was the most scary for me the integrated dissection and reentry, because I thought, well, I'm going to just totally destroy this whole vessel with this crazy technique, but now I'm doing it more often and more and more and more, and it's just one of the techniques which is in the armamentarium, and that's it. But I don't know. There was a sense of fear for that technique. I don't know why, because it was at first it was so crazy concept, but once you get to learn it, it makes sense.
Wonderful. And then, in terms of contrast, radiation, etc., have you had any issues? Do you do any special things to protect yourself and the team, or?
Well, what we do with contrast, we try to always calculate the maximum amount of contrast the patient may receive. It's not a hard stop, but it tells me, so the nurses tell me, well, we are at 100 cc's, we're at 200 cc's, etc. I try to limit it as much as possible, obviously. So I've seen operators which pour up to 1 liter of contrast into a patient. Well, that's crazy. You won't see me do that. No, but we try to be very aware of the amount of contrast in terms of radiation. We have our lead aprons. Obviously, we have all the lead protections. We don't have these movable lead-free. How do you call them? Rampart like.
Rampart, zero gravity.
We still use
Nest,
the lead
all those
aprons,
things.
etc. And one of the most important improvements in the future for us will be in the next month, we will receive 2 new cath labs with new, I think will be Siemens hardware. Those will be also major improvements. So we're working now with 10 plus year old machines. Yeah, that does not help. So new technology will definitely help us, but we're always using red pads. We're also always using goggles. Everything just to reduce. And when I look at my yearly amount of radiation, which is closely monitored, then I'm well below the threshold values. So yeah. And in terms of patients, which is obviously also important, we try to vary the X-ray beam, but we never exceed very dangerous amounts of radiation, which you also stated in your book, obviously. But then again, I think there is still a sort of gray area that we don't let patients, we don't see them back to check for any radiation-induced trauma or something like that. So we don't have a program for that to really check on that.
Wonderful. Are there, Adriaan, any cases, good or bad, that stick to your memory, that taught you a lot and you always remember?
Yeah. Well, for sure. But there was this one case which made a deep impact. It was in the beginning, and when I worked here in Utrecht, and there was a patient which just came in for an LED stent. We post-dilated, and the post-dilation, the non-compliant post-dilation balloon wouldn't deflate. So I asked the nurse, please deflate. She deflated, but the balloon did not deflate. So that was and the patient immediately collapsed. So proximal LED, and I tried to get the balloon out. I pulled gently, and maybe I pulled a little bit too hard. So the catheter came out, catheter shaft, but the balloon was still stuck inside the patient, inflated in the left main, which was a bad situation. So eventually the surgeon who got involved, we put the patient on VA ECMO, etc. But in the end, the patient did not make it a couple of days later. So that had a great impact, because there was also all the implications afterwards with the company who made the balloons, etc. And it made a deep, deep impact on me as a physician, as a doctor. Yeah, I learned a lot. Also, not just to how to manage that complication, but also in terms of all the consequences which were involved, which were quite major actually. So that was from one side. Also, very positive things. Obviously, we have helped many patients with really great procedures. Seeing them improve is obviously very rewarding, but in the end it's all about the patient. So we're using all the techniques. Every technique has been successful in one way or another. We're just very fortunate to have all these techniques and all these possibilities to help our patients.
Wonderful. And also in terms of teaching, how do you choose the people who want to learn? I'm sure many people approach you and they want to learn and they have different levels of expertise or hand skills. How do you choose, and what excites you in someone who wants to learn?
Enthusiasm is the most important aspect for me. It all starts with enthusiasm and just presence, just being there. Fortunately, we don't have a lot of fellows right now. That has something to do with budgets, etc., and choices by the hospital. But we did have some colleagues coming to our department to learn specifically CTO operations in the past, and these were all very dedicated colleagues who really wanted to learn and are eager to learn. And what we do is just scrub in, do the case together. And I also like to coach a little bit from a distance, just to let my co-workers work on it and see if they can manage the case. And it helped a lot of my. We trained a couple of co-workers and colleagues for CTO intervention, and I hope to have some additional fellow anytime soon.
Wonderful. Now, in terms of yourself, again, demanding schedule, stressful cases, etc., how do you keep yourself in good shape to deal with all this?
Well, Manos, one of the things for me which works very well is running. We met each other in Nice as well, and you were also running back there. So now it's for me, it really helps me to really unwind and just think about nothing or think about something for work or very private. I don't run with any headsets or whatever, no distraction, just run. And then with a goal to train for a marathon or some other run, and obviously family. But those are the two important things now in my life next to our demanding job, indeed.
Did you run any races recently or planning to run any races?
Actually, I ran a marathon last Sunday, but it was not, it was a great run, but it was not 100%. And I'm planning to do obviously some runs next fall and next spring, again, a marathon in Rotterdam. That's the most well-known marathon in the whole of the Netherlands. So having some things to look to be excited about.
Wonderful. How many hours do you sleep every night?
Not enough. No, I think I try to sleep at least 7 to 8 hours, and sometimes it's a bit less. But if I don't do that, I also notice during the week that you build this sleep deprivation or sleep lag during the week, and I really need to catch up in the weekend again. And the most difficult thing for me as an interventional cardiologist, I think, is when you're on call, let's say on Sunday night or Monday evening, and you get a call for a primary PCI in the middle of the night, and you have to work the rest of the week. Then you're done. We are a relatively small group, so we don't have a lot of interventional cardiologists. So our on calls are quite frequent. And that's a bit tough right now, but hopefully that will change anytime soon. Working on it.
Wonderful. Well, it looks like you're fairly resilient with that. How about any favorite books or any favorite movies that you have?
Yeah, you sent me some of those questions already. So unfortunately, I don't read a lot literature right now. Because of family, work, sports, running, etc. Films, movies. I don't think there are these many interesting movies released recently. So my greatest memories go back to the 90s. Movies like that, like The Shawshank Redemption and Forrest Gump. And my kids also like these movies. So I think if my kids like it, then it's really a great movie.
There you go. Perfect. And that's actually similar to what other people have said before. So now, in terms of right now and the future, what are you most excited about in your job and professionally and personally?
Our team is, we're trying to reorganize a little bit. So our team will be expanded hopefully anytime soon. We'll probably have this restructuring of our department in the coming years, which will be quite exciting. We hope, we just proceed with our complex PCI program. We'll try to do some more complex PCI, but also some more structural heart interventions. So we're doing, let's say the regular structural heart interventions like TAVR and MitraClip, but we don't do the mitral valve replacements quite frequently, and we don't do any tricuspid intervention. So there's room for opportunity. But then again, our center is a transplant center and an LVAD center. So our focus of the center is really on heart failure and really advanced heart failure. So we'll hope to expand our expertise and expand our the opportunities we have for treatments with our patients even more on that side. And from a personal point of view, it's just raising my kids and seeing how they will grow up, and with all the fun things, but also the difficult things which come totally free. You get it for nothing. That's great. And just
Does any of the kids want to follow your footsteps and
it's a bit too
and go into
soon. So
medicine?
they're in high school right now, or two of them are in high school. I think sometimes they suggest something like that, and I'm not saying they should. I also not saying they shouldn't do it, but we'll see. We're not pushing them at all. So just want them to achieve to their abilities and enjoy themselves as well.
And then, what are you most proud of the things you've achieved so far? What are the things that you're most proud of?
Here in the UMC Utrecht. So when I look from the professional side of things, I helped organize a couple of projects. Let's say, for instance, just getting Impella in. We started with Impella 6 years ago. So we had VA ECMO, and just getting all the departments with the noses in the same direction. What I really like is to pull a relatively simple project and from start to finish with a very practical approach. That's what I like, and that's what I think is one of my strengths. We had Impella is one of the things we did. We started out with doing thrombectomies in pulmonary embolism patients. I'm a PI of a trial in the Netherlands which examines thrombectomy in high risk pulmonary embolism patients versus thrombolysis, which is it's a really important clinical question. And together with a great group of colleagues in the Netherlands, we started this trial. So those are also one of the things I'm proud of, and which the trial is currently including. So very excited to see what the results will be.
Wonderful. Well, looks like you've been very busy because not just doing the complex cases, but also expanding the research area. I mean, that's a lot of fun, a lot of work.
But it's a thin line, Manos, because I like to do things in the cath lab. I think I'm quite proficient in the cath lab. So it's a balance of helping our patients and spending time in the cath lab, not wearing out, and also doing some research. And right now, research is like clinical work is there and research is there, and sometimes it's a bit more like this. So it's demanding. Yeah.
Well, it's always rebalancing, and it's like the CTOs, right? You always find different pathways depending on how things evolve. So Adriaan, again, you've done phenomenal work. If you had to give some advice to the new generation of people who are starting to do complex or more advanced procedures and they want to learn, what would you advise them to do?
One, read your manual. Read your manual, not once, not twice, but 3 times at least, because repetition is. It's all about repetition and just seeing and knowing what to do. Have the skills. We also have this great book, the CTO toolbook by Mihai Kovacic, which is also great. Just read it and see what's out there. You don't have to use everything. Just if you are proficient with, let's say, 5 or 6 wires, start out with that. Don't try to get proficient with all of the wires all at once. Same holds true for microcatheters. So you can have 10 different microcatheters in your cath lab, but for me it doesn't make sense because I think we have 2 or 3, and I use them many times, and I know what the properties are of these microcatheters. So don't go for all the materials. use the materials which you think you need. So there has to be this basis of obviously of the tools you will need to be a good CTO operator. Because there are so many things on the market. Visit 1 or 2 live course per year. Not too many. There are too many live courses, I think. So if you're a live course operator, that's great. But I think 1 or 2 of those meetings per year is sufficient. But it's a great learning opportunity because every time you see, even now, you see different cases, and some of them are really straightforward and simple, and you can discuss those cases for 2 hours. And there are really great complex cases which take a lot of time, also are complex and are complicated by various complications. And I think it's a great way. But and then proctoring, I think it's also really important, just to or work in 2 or 3 hospitals, because every hospital works differently. So I would suggest to take a look at least outside in 1 or 2 other hospitals to see how they work and to see how things are done, and just pick out the things you think you will need and which coincide with your the resources you have and the skills you have. And it takes time. So it takes a couple of years, I think, to be really proficient. So be patient.
So this is not something that's going to happen tomorrow, right? You start doing this, but it's a process and takes quite some time. Wonderful. Well, Adriaan, again, thank you so much. I really appreciate you spending the time with us today. Congrats on a great program that you've built. Looking forward to the results of your pulmonary embolism trial.
Thank you, Manus.
And look forward to running with you one of the upcoming courses.
That's a great idea. Thank you very much for your kind invitation. It was a great honor for me. And I hope to see you anytime soon. And thank you for your opportunity.
Thank you. Thank you for listening to the Sensei podcast.